This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
COVID-19 media briefing. This is a Q&A about vaccine. It is being aired live on YouTube. Joining us today are DHS Deputy Secretary Julie Willems Van Dijk and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and a part of our COVID response team. And we begin today's briefing with remarks from Deputy Secretary Julie Willems Van Dijk. Julie?
Good afternoon, and thank you for joining Dr. Schauer and myself for this vaccine update. You know, it's almost hard to imagine, but 1 month ago, we had no vaccine in Wisconsin. Our first shipment and the first shots in arms didn't come until December 14th. So we are still less than 1 month into this COVID-19 vaccination effort. And even in this short amount of time, we've built a system that works. As of today, 151,502 doses of COVID-19 vaccine have been administered, with 11,586 of those second doses. So indicating people who have completed their full series. This is a great accomplishment, but it is not enough. We continue to expand our network of enrolled vaccinators, and increased vaccinator capacity means that we can vaccinate more of our phase 1A population here in Wisconsin. But that is only possible if we have enough vaccine. Last week, we had more requests for vaccine from our vaccinators to immunize phase 1A workers than we had vaccine to send them. We need more vaccine. The federal government allocates COVID-19 vaccine to each state by total population, not by phase 1A population. Phase 1A includes healthcare workers and the residents and staff of skilled nursing facilities and assisted living facilities. Because we have a high proportion of long-term care residents and healthcare workers in Wisconsin compared to our population, we have a lot more people to vaccinate in phase 1 compared to vaccine received. So we need more vaccine to be allocated to our state. That is why we at DHS joined Governor Tony Evers today to call on the federal government to increase the amount of doses in weekly allocations. In less than a month, we have built this system. We are expanding it. We stand ready to grow it further, and we cannot do that without more vaccine. We will soon reach the point where we have vaccinated the majority of people in phase 1A who want a vaccine. Our goal is to never stop vaccinating. So in anticipation of reaching that phase 1A majority point soon, we are announcing today that first responders in our police and fire departments will be eligible for vaccination starting next week. Operationally, this is a seamless way to begin our movement into phase 1B, since our police and fire departments are already working so closely with EMS and our local and tribal health departments across the state. However, there are many people in phase 1A who still need to be vaccinated, and many more people in phase 1B who will soon be eligible to receive vaccine. So let me reiterate that we need the federal government to increase our weekly allocation. Thanks, and I'll turn it back to Elizabeth so we can take your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it is time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and unmute. Today's first question belongs to Denise Lockwood from Racine County I. Denise.
Hi, I just wanted to understand what some of the biggest challenges are that you guys are facing with regards to getting the vaccine out into arms. Thanks.
Well, I think I said the biggest challenge is that we need more vaccine to get vaccine into arms, Denise. I would say in terms of setting up this system, Certainly one of the big challenges is the fragility of the vaccine. So particularly the Pfizer vaccine must be kept at -80 degrees centigrade. And it is quite a complex process to move it from a hub to one of our spokes where people can give vaccines. We've got an incredible team working on this. We haven't lost any vaccine, which is incredible testimony to their expertise. But it's a very complicated process about how many minutes the freezer door can be open, how the vaccine has to be transferred into dry ice, how it has to be temperature monitored all the way, and the number of transfers we have to make from our hubs to our spokes is increasing every week with our increased number of vaccinators who are willing to vaccinate, and we need to get this vaccine to them. Once it arrives at their location, they have 5 days to use that vaccine once it's been unfrozen. And so we also have to have our vaccinators titrating very carefully how many people will receive vaccine to how many doses they've requested to once again assure we don't waste any vaccine. And I want to emphasize, this is why sometimes you'll hear of somebody outside of phase 1A receiving a vaccine, because when our vaccinators and the spokes have a certain amount of vaccine, let's say they have 100 doses, and they expected 100 people to show up at a clinic, for example, for EMS workers or for dentists or for other unaffiliated healthcare workers in their community. And only 80 showed up and they have 20 doses left over. They're going to quickly call people in phase 1A, see if they can come in and get those doses. And if not, they're going to give them to other people who are nearby who they can vaccinate, because we don't want to just say we're going to throw it out since there was no phase 1A person there. So those are some of the challenges. I'll turn to Dr. Schauer and see if there is anything you would add on that.
Yeah, I would just add that it is a very quick turnaround time and almost being on a treadmill in terms of the time from when the state receives an allocation to providers letting us know how many doses they need to the vaccine being shipped and then going ahead and administering that. And that all happens within the span of a week and then is repeated. So it is a quick time frame and does prove to be a challenge in that respect, in that always needing to stay on top of your game and watching for that email of the number of doses that you need.
All right, thank you both for that. Let's go now to Scott Bauer with the Associated Press.
Hi, thanks for doing that. I see in a letter from Governor Evers to a couple congressmen, he estimates that the general public won't be vaccinated until starting in June. Is that still the current estimate for DHS, and how might that change if President-elect Biden's plan goes into effect to speed up that initial dose?
Yeah, Scott, the looking into the crystal ball and knowing exactly when the general public will be able to get vaccine is a really challenging job here. And so I keep saying late spring, early summer. I think June actually meets that definition. And it's something we'll know better week by week as we move along. You know, 2 weeks ago, we hadn't done a whole lot of phase 1A, and now we sit at a point where somewhere between 25 and 30% of our phase 1A participants have been vaccinated, and we're getting ready to start moving phase 1B into that group. We'll see when it'll be time to open up to the general public. I know there are folks who say we should do that now, but if we do it now with the level of vaccine that we have available, we will just create mass chaos. Big, long lines, crashed IT and phone systems, and that is not what we want to do with our healthcare providers, with our local health departments. As I've said to many people, you've seen the scenes of grandmothers sitting in their lawn chairs waiting in line in Florida, and it's a little cold in Wisconsin to sit in a lawn chair in a line right now. So the biggest thing that will help us move that faster is increased production from Moderna and Pfizer. the 2 vaccines already licensed. We are very hopeful that the Johnson & Johnson vaccine will prove to be effective and receive an emergency use authorization, perhaps even by the end of January. And we know there are 2 additional vaccines in clinical trials. And if those prove to be effective and can move out of clinical trial into emergency use authorization, that is what will really get us there quicker, is not only more of the kind of vaccine that's already authorized, but more vaccines authorized.
Thank you for that. Let's go now to Stephanie Hoff at WisPolitics. Stephanie Hoff at WisPolitics. A reminder, *6 will mute and unmute your phone.
Hi, this is Royce Pedezwa. I'm filling in for Stephanie today. I wanted to ask, why is there such a difference between the number of vaccines that have been shipped to the state and the number of vaccines that have actually gone into people's arms? Thank you.
Yeah, as Stephanie Schauer mentioned a few minutes ago, this is a pretty complex process that happens every week. The federal government allocates a certain number of vaccines to us. We do a survey to our vaccine providers who tell us how many doses they would be able to administer in the week. We then input all of that information into the federal system, and then they turn around and ship that. So that all happens the week before people actually have the vaccine in their hands. And so once it arrives, starting Monday, Tuesday, Wednesday, then they need to take that inventory and start vaccinating people in the following week. So there's always, this week, I think we're sending out about 105,000 doses of vaccine. So that's a week's inventory, and you're always going to have at least a week's inventory on your shelves. Right now, it looks like we have about a week and a half inventory. But that's the vaccine that is in people's hands that they're planning for to get into the arms of people in the state. So that's the biggest discrepancy between that shipped and administered number that you see. We're all working on ways we can make that happen faster from shipped to in someone's arm. But there's always going to be a certain amount of vaccine that is in the inventory getting ready to be delivered.
Thank you for that. The next question now to David Wahlberg at the Wisconsin State Journal.
Yes, thank you. I was wondering about the SDMAC vaccine subcommittee. They've been discussing who exactly might be in phase 1B, and they're meeting tomorrow to hopefully finalize that plan. I understand that they're advisory to DHS. How much does DHS plan to follow what the committee says, especially given that you've already announced police and fire coming soon, which is sort of before what the committee has come up with?
Right. So as you know, David, in phase 1A, we followed precisely what SDMAC shared with us. We did that after review of the rationale and the decision-making behind how they produce those recommendations. And we will do that same process when the phase 1B recommendations come to us. We've made this an open and transparent process. The committee considers the recommendations based on a number of ethical criteria, and then they produce a draft document that goes out for public comment. So we are eager to both read the full report that SDMAC provides to us and to hear the public comment, and we'll make a final decision after all of those steps have been followed. We have made a decision to move forward with one of the groups that we know are in their draft proposal, because we're also balancing their good and scientific counsel to us with vaccine supply and keeping the system moving. And so we are looking at the reason we chose to move forward with a population is it's one that seems fairly likely to be in their final recommendation. It has been in many, many other states across the nation. And so it's a balancing act between the pace of this important process and keeping the vaccine moving.
Thank you for that. Let's go now to Rob Sussman at WTAQ in Green Bay. Rob Sussman.
Yeah, thanks for taking my question. You have mentioned before that you'd like the federal government to send more vaccine. My question is approximately how much vaccine do you think the state should be allocated a week in order to get vaccination moving at the pace that DHS would be more comfortable with? Thank you very much.
Well, right now, we're receiving about 70,000 doses for new patients, first-time patients per week. And if we look at a goal of 1 million doses a day, for example, the goal that President-elect Biden has set, that would bring us to needing about 125,000 doses a week. So, clearly, I'm sorry, I can't do the math, 55,000 more doses a week than we're currently receiving. I think that'd be a great next step. Let's go. Let's come together as a nation and do 1 million doses a week, and every state would have to step up and do their part. But even at 1 million doses a day, we have 330 million people in the country. That's going to take a whole year. And so I think we need to up the pace even more than that and be trying to get to a point where we're doing closer to 30, 40, 50,000 doses a day to get us quicker to the goal of 80% of our population being vaccinated would be where we would want to see ourselves heading. Dr. Schauer, anything you would add to that?
No, nothing to add. Thank you.
Thank you.
And thank you both for that. Let's go now to Will Cushman at WisContext. Will Cushman.
Hi there. Thank you. I think this has been touched upon in previous briefings, but I just kind of want to circle back there right now. I've read some reports about vaccinators being able to kind of stretch more doses out of a vial than manufacturers state are in a vial. Are you aware of vaccinators in Wisconsin broadly, or any specific reports of them being able to stretch more doses out of vials than the manufacturers say should be in there? Thank you.
I'm going to turn to Dr. Schauer for a response to that question, please.
Yeah. Yes, we are aware that that is a possibility. Both manufacturers have indicated that you can get a 6th dose and as well as possibly an 11th dose out of the different vaccine allocations, and have really provided guidance about when that's appropriate and making sure that vaccinators are, drawing up the proper amounts of per dose and that they're not mixing vials, et cetera. But that is certainly something that is possible and does happen on occasion. I don't have the numbers of how often that happens, but it certainly has been recognized, and not wanting to waste any doses, that if that is available, that dose can be used.
Thank you for that. Now to Danny Maxwell at WKOW in Madison. Danny Maxwell. WKOW. All right, we'll try to get back to that outlet, and we'll go now to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. The Pharmacy Society of Wisconsin released a letter sent to DHS today asking for an immediate start to phase 1B and a rapid expansion of pharmacies getting vaccine. Do you have any response to that letter? Why wait a week to start some of these phase 1B groups? Thank you.
Well, I'm going to turn to Dr. Schauer in a moment to talk about our relationship with pharmacies across the state, but let me answer the question about Phase 1B. So first of all, we have still a significant number of Phase 1A that we are vaccinating. We are in the midst of the vaccination of our long-term care residents in both skilled nursing facilities and soon to begin assisted living facilities, and we need vaccine for that. And we have a number of unaffiliated healthcare workers who are still in line to get vaccine. Again, the issue here is titrating the number of doses to the number of people available. And I think the Pharmacy Society will be pleased to hear we are moving forward with police and fire. And we are preparing ourselves to move very quickly after the SDMAC recommendations into broader groups of Phase 1B. But let me turn to Dr. Schauer and talk about the work we've been doing with the Pharmacy Society and pharmacies across our state and ways we are activating them in the response even as we speak.
Yeah, so in Wisconsin, pharmacists have played such a large, important role when it comes to influenza vaccination as well as vaccination for other vaccines. And so we have a long-standing, good working relationship with the Pharmacy Society, and they've been very engaged in wanting to assist. They certainly are part of the cadre of fully enrolled providers that we have enlisted, and they are receiving the surveys regarding vaccination of Phase 1A in particular. And so we do go ahead and rely on pharmacies. They have to they're a key component in this whole vaccination effort. And so we are continuing to work with them and meet with them on a regular basis and ensure that there's coordination both from what they're doing as well as with local public health and other healthcare entities. You know, we're all in this together. It's really important that we have all hands on deck and that all are working together. And pharmacies are certainly included in that group.
Thank you. Let's go now to Babs Santos, WLUK in Green Bay. Babs.
Hello, I'm wondering about how many police and fire personnel do you anticipate could receive the vaccine in the near future?
So our current estimate of that population is approximately 30,000 people, and it would be our goal that all of them could receive the vaccine.
All right, thank you for that. Now to Amanda Quintana, News 3 in Madison. Amanda.
Hi, yes. So for this next phase, even 1B, are hospitals responsible for hosting clinics to administer vaccine to groups in 1B? So I spoke to a rural clinic today, and it sounds like it would be really a struggle for them to find enough employees to vaccinate their whole community.
Yeah, there are a variety of ways that we will vaccinate each of these populations. I think as we move into Phase 1B, one of the ways that hospitals and healthcare systems can be helpful is to vaccinate their own patients. So for example, if Phase 1B includes patients who are over the age of 70, hospitals can contact their patients over the age of 70 and schedule them to come in and get their vaccine. Now, hospitals may not be as readily available to do that, for example, with teachers or police officers, because they may not have that occupational information in place, but they can certainly query their patients. And if they know they are one of those occupational settings, they can also vaccinate them in the course of seeing regular patients. You know, one of our mantras in immunization work is never have a missed opportunity for a vaccine. And so as we move forward in these broader groups, we would like to see hospitals and healthcare systems starting to incorporate vaccination for COVID-19 as part of any visit you have at your clinic. In addition, though, that's why we are doing a number of targeted outreach to different groups. We know we have local health departments stepping up across the state and either vaccinating people in these groups, including for right now, they're vaccinating EMS, they're vaccinating dentists, they're vaccinating other unaffiliated healthcare workers. local health departments can do that in a number of ways. They may do the vaccinations themselves, or they may serve as the coordinating force in a community and say, look, we have these 3 pharmacies in our community, and they will advertise and let those populations know, here are the pharmacies that are doing those kind of vaccinations. And in addition, we have a number of health systems who are stepping up and saying, we are going to have community clinics across our community, and we're going to invite phase 1A and phase 1B populations to come to those communities, and we will work and do those vaccinations. And then finally, the state is working on standing up some mobile vaccination teams to help supplement these efforts. We're particularly focused on smaller rural communities that may have the access issues that you're describing. And the state is working on a contract with a vendor to even more fully expand those mobile vaccination clinics again as we move into a situation where we have more vaccine and more people going to receive the vaccine every week.
Thank you for that. Now to Shemaine Mills at Wisconsin Public Radio.
Hi, this is Madeline Fox filling in for Shemaine. Could you talk about what entities, whether they're manufacturing, whether they're storage, are currently expanding with regards to the vaccine supply chain, and how we're going to get, you mentioned, of course, more doses, but what other ways we're working to get more shots in the arm of various people as the vaccine supply does increase, hopefully.
Dr. Schauer, you want to talk about that a little bit?
Sure. I mean, I think it's important, as I mentioned, we have a large number of vaccinators from all different areas, both in terms of whether it's local public health, whether it's healthcare and pharmacists, as well as commercial vaccinators, and even some capacity through the state. That is all important. And as noted earlier, that where individuals receive their vaccines is going to differ. And as the vaccine supply increases, we're going to move towards a model where it's closer to being something more akin to influenza vaccine. So an individual may receive their flu vaccine from their healthcare provider, but they may also be able to get it from a retail pharmacy. And so I think we look towards the expansion as more vaccine becomes available, the access points increase and we move out. So I think as we move further out, that becomes easier versus when it's a little bit more limited and we have more strict criteria than we have.
Thank you for that. Now to Brittany Schmidt at WBAY in Green Bay. Brittany Schmidt.
Hi, my question is about the vaccination itself. I know over the weekend, a lot of federal health experts have talked about or even wanted, I think Biden even said that they wanted to kind of not hold on to a second dose in the federal government, but rather ship those to local governments in order to get more shots in arms. But is that something you guys are considering? Because we know that the most effective way that this vaccine works is if you get that second dose after 3 weeks, 4 weeks, depending on the vaccine. Is that something you guys are considering?
So throughout this response, we have said we are basing our response on science, and the science for this vaccine, for the 2 that are under emergency use authorization right now, is that it is a 2-dose series. And we are not recommending anything other than a 2-dose series. Now, having said that, we understand there is a lot of vaccine stored away, some of which is held in reserve for that second dose, some of which is excess vaccine being held in case of production problems. And so part of what is the request to release that vaccine is assuming that our production is up and going, that we get more of that vaccine out into first doses now and know that production will follow to get the second dose available to people when they need it. It is, as I think about this, I think about it's kind of like a savings account. Some people want, 2 years of income in the bank before they spend any money. And, you know, I would say the process we're using right now is a fairly conservative approach like that. Whereas other people feel like if they have a couple of months, they're okay going ahead and spending money. And I think there's just the discussion here is about how conservative a reserve do we want to have right now. But given that people are dying every day from this disease, and given that people want this vaccine, I think the request of Governor Evers and our state is to please move more of that vaccine quicker, because a shot in the arm is protecting a life. And that is what we are here to do.
Thank you for that. Let's go to Jorge Rodas at Spectrum News.
Hi. So I've spoken to several doctors over the last couple of weeks about, you know, the vaccine. From what they tell me, is the vaccine is only effective, really, if the public still takes the precautions when it comes to social distancing, wearing a mask, hand hygiene. So we've got a big event here in Green Bay coming this weekend with the Packers in the playoffs, and we're hearing about people having parties, and, you know, there are going to be fans in the stands who are not family members or workers for the first time this year. So what, if any, message do you have for people this weekend, given that it's kind of a big weekend with expected crowds?
Yeah. So I think one of the things I'm very grateful for is that the Packers play outside and we'll see what the temperatures are at Lambeau Field this weekend. But clearly this is not the same as a normal playoff game. The crowds will be much smaller than they have been. And what I encourage every person who may be attending that game to do is, this is not the season to have tailgates in the parking lot and intermingle with lots of other parties from other parts of the state or other families that where we could have cross-contamination of virus spread across people. Of course, wear your masks, and I think the weather will help that. The mask will keep you warm as well as keep you protected. So please wear your masks at all times. Maintain social distancing as much as possible. I know that is why there will be fewer fans at the game, is to maintain that. Put your hand sanitizer in your pocket and use it throughout the day anytime you touch a surface. And definitely cheer on the Packers. That is a very important part of our protection here too. But all of those things we have been talking about, this will be a test. It will be a test to see how well we can do that in a smaller crowd and what the impact will be on our state of disease transmission as a result of it. But we need the fans who are attending that game, whether they've had vaccine or not, to be following all of those good public health practices so that we don't spread more virus that will result in vulnerable people acquiring the disease, getting ill, needing to be hospitalized, and potentially passing away. We do not want to inspire more disease spread with that event. And so please take all of the precautions that we have outlined here.
Thank you for that advice. Let's go now to Angelica Sanchez, Fox 6 in Milwaukee. Fox 6 in Milwaukee.
Hi there. Thank you for holding this briefing. My question was regarding that group of pharmacists that sent a letter to DHS this morning. I know that this question was asked a little earlier, but I just kind of wanted to expand on it. You know, in the letter, they're kind of saying like it's time for an all hands on deck approach to the vaccine distribution. Do you believe that when phase 1B is implemented, that they will be part of those people that can distribute the vaccine?
First of all, I want to emphasize they already are part of the people who can distribute the vaccine. In a moment, I'll turn to Dr. Schauer and she can give you an estimate of how many vaccine providers we have who may be pharmacists. But let's be really clear. We are building the system for phase 1B. Of course, pharmacies will be part of that. We want them to be part of that, but we can't fully open phase 1B right now because we do not have enough vaccine. Phase 1B is currently being debated by the SDMAC is almost double what phase 1A is. And if we have the same amount of vaccine and we nearly double the population that's eligible to get it, before we've even finished the first phase, we're going to have very long lines. We're going to have very many people very upset because they still can't get vaccine because we don't have enough. So the key to accelerating this, I want to say once again, is more vaccine. We're building the system so we can deliver more vaccine, and pharmacists are a critical part of that system. We're building demand, and we clearly have demand, but we have to have vaccine to be able to deliver on that. So Dr. Schauer, you want to speak to, the volume of pharmacies that may be part of our full group of vaccinators?
Yeah, so we currently have nearly 1,200 completed vaccinators available to receive vaccine and administer it here in Wisconsin, and many of them are pharmacies. I think it's important to note that while it includes medical clinics and hospitals, local health departments, tribes, it also includes pharmacies, and so they are a key component. Just also a reminder that we do have pharmacies that are helping to go ahead and implement the vaccination of our skilled nursing facilities, and they'll be moving on to the other long-term care facilities. And so that is a big effort that's part of that federal program that Wisconsin took part in, whereby we have 2 chain pharmacies that are going ahead and providing the vaccines to individuals within those facilities. Just an update on that is that as of this weekend, we had 193 out of the 361 skilled nursing facilities have received dose 1. We anticipate that they will continue to vaccinate this week, and we'll probably finish up those skilled nursing facilities and then transitioning over to the long-term care. And as a result, we have, and this is as what was reported as of the 9th, was about 18,536 doses were administered, all by pharmacists.
Thank you for those numbers and those answers. And we go now to Angelica Levito at Bloomberg News.
Great. Thank you for taking my question. I just wanted to ask if you could help me understand, there's a lot of talk about increasing the supply that comes to Wisconsin, and I know you said there's a lag, but it still appears that the state has only used about 1/3 of the doses it's receiving. So why should the state receive more? And if it does, can the state providers handle that? And I'm also wondering if you've received any indications from the federal government about what your allocation will be going forward.
We generally receive our allocation numbers on Tuesday. How I would describe the vaccine that we've received to date is we've given about 1/3. About 1/3 is held for the long-term care pharmacy program, which we've begun. And as you've heard Dr. Schauer say, 18,000 doses have been administered, but there's many, many more to go because that program is 190,000 doses altogether that are being held for that program. And then about 1/3 are on the shelves or in transit. So that is why we need more vaccine, because that 1/3 is being administered in long-term care, 1/3 has already been given, and the remaining 1/3 is the supply that's available for the next couple weeks. The other thing I would say is last week was the first week in our weekly survey that the number of doses requested by our vaccinators exceeded the number of doses we had available. And I am certain that is going to happen again this week. And so you build the system to request the vaccine so they can put it in the arms of people. We have built that system. Our vaccinators stand ready and willing to give more vaccine, as noted by the letter from the Pharmacy Society of Wisconsin, and we would love to fulfill those requests, and that's why we need more vaccine.
Thank you for that. Now to Rebecca Klopp, WTMJ in Milwaukee. TMJ4, Rebecca.
Hello, thank you so much for taking my question today. You pretty much already addressed one of my questions, so I wanted to ask about one of the COVID tests, the curative test that the FDA issued a warning about, a safety warning about. The curative test is issued in Milwaukee. It's also issued in a couple other counties around Milwaukee. And Los Angeles County just over the weekend decided they would no longer be using the curative COVID-19 test at their pop-up sites because it produces false negatives. Is DHS have any kind of guidance? Are you suggesting that cities and counties around here stop using the curative COVID test?
I am not prepared to answer that question right now, but we would be happy to get back to you. I haven't read these reports. Dr. Schauer, by any chance, have you been focused on this? No, but we would be happy to get back to you with a response on that.
Okay, we will do that after this briefing. And for now, we will go on to Henry Redmond at Wisconsin Examiner. Henry Redmond.
Hi, thank you. It's been discussed before that comparing vaccination rate with other states isn't really helpful. So what metrics are DHS using to make sure vaccinators are working as quickly and effectively as possible as they get vaccines into arms?
Yep, we're looking at the throughput, and we're looking at how much vaccine we're sending out. We're looking at how many vaccines have been given. The ultimate measure of our success is how many people have completed their series and what percentage of the population has been covered with the vaccine to produce herd immunity. So these are all measures that are very important to us as we move forward in measuring our success. Dr. Schauer, what might I have missed that you would add to that?
Oh, I think you hit the nail on the head. Exactly.
Okay.
All right, thank you for that. Now to Matt Smith at WISN in Milwaukee. Matt.
Hi, Tommy Thompson told us last week that he has offered UW facilities across the state to help administer the vaccine. Curious if and when that will happen and where that may be in the planning stages.
Yep, we have regular meetings with President Thompson and with members of his team. And you guys are going to get really sick of my broken record response here, is that will happen when there is more vaccine in the state for us to open up those clinics. But we are very eager to take President Thompson up on his offer to use university space for mass vaccination clinics. He has offered staff to be able to assist in staffing those clinics. As I mentioned, we're bringing on a contractor to assist with vaccination, and we think this could be a great marriage between that contractor and the university. And so that is what we're thinking as we're moving forward. But in addition to space and staff on campus, the other thing that President Thompson has offered is their health sciences students, in particular nursing students, pharmacy students, to be part of our vaccination efforts. And so we are working on an agreement right now with the university system for nursing students, pharmacy students, and perhaps other health sciences students to be the vaccinators at the mobile vaccine teams that I spoke of earlier. And so we're very excited about the opportunity to bring those students into this environment, and the win-win of that they'll be contributing to protecting their fellow residents of Wisconsin against this terrible virus and gaining the clinical experience that they need as they move into their healthcare careers.
Thank you for that. Let's go now to Seneca Bargo, WMTV in Madison. WMTV in Madison. All right, we will try to get back to them. We'll go now, Tom Lally, WAOW, Wausau. Tom Lally, WAOW.
Hi there. Thank you for taking my question. You already talked about this a little bit, but in other states, we've seen some doses going to waste. Vaccines are removed from the freezer, administered to 1A individuals, and then extra doses left in the vial expire. Have you seen that case of those doses going to waste happen in Wisconsin? And what's your guidance on that situation?
Dr. Schauer, would you like to respond to that?
Yeah, and I think this was touched on a little bit earlier, but really, we never want to see a dose of vaccine wasted, and certainly encourage facilities to have a list or a roster of eligible individuals, so that at the end of a clinic day, if they do have extra doses, that they can quickly call those individuals in and go ahead and administer it. And certainly, if there are non-phase 1A eligible, that would be the last resort versus having wasted doses of vaccine. So we have received calls and have really counseled in some situations. We have been able to move the vaccine to another vaccinator so that those doses can be used. So I think it's a multiple different approaches to go ahead and reduce the amount of wastage that is seen.
Right. Thank you for that. Daphne Chen, Milwaukee Journal Sentinel. Daphne Chen.
Hi, thanks for taking my question. I was wondering, what's your best estimate lately for the percentage of people that are refusing or delaying the vaccine? And is that possibly driving why hospitals are having these open slots that they're, rushing to fill with people?
Yeah, that's a great question. And we do not have specific data on that. We've only heard anecdotes, and they vary from place to place. And that definitely is part of the reason we haven't gotten to 100% yet. And is also why we will never wait until we get to 100% of any phases eligible people before we would move forward. I would like to say this about people's choosing of the vaccine is we certainly know that some people are eager and ready and want to be first in line to get this vaccine. And we know there's a very small percentage of the population. In a recent report I was reading, it was estimated about 10% of people who have said, nope, not going to get the vaccine at all. But there's a big group in the middle, estimated around 39–40%, that are just playing a little bit of wait and see. They want to see what happens when millions of people get the vaccine. They want to see if side effects or adverse events rise. And if they don't, they'll be ready and willing to get that vaccine a few months from now. And so this is a process, and I think we will continue to see people who might say no now say yes in a month or two, and we will continue to be there. I want to be really clear. If you're in phase 1A and you weren't quite ready to say yes to the vaccine now, you haven't lost your opportunity when we move to phase 1B. That opportunity will still be there throughout the whole vaccination process. And what is really critical is that we reach a high enough immunity level of people accepting this vaccine that we will really create a wall against the virus. It's not just my protection as an individual, it's our collective protection as a community that protects us against the virus. And so it's really important that we reach immunity levels at 75–80% in order for us to be a well-protected state against this virus. Stephanie, anything you would add?
Yeah, I would just say that, these vaccines continue to be studied. We expect more safety and efficacy data to be coming. So that will hopefully continue to come and reassure people about the vaccines. And so, as we've said, the door doesn't shut. If folks aren't ready now, maybe in a few months, and there will be more data and they will feel more comfortable. They've heard the experience of friends and family and they're ready. And we certainly want to be there and make sure that they have a dose ready for them.
All right, thank you for that. That was our final question. We do have two reporters who weren't available on our first go around on the list. So let's try to go back to WKOW. Danny Maxwell, WKOW. All right, and WMTV, Sanica Barga, WMTV. Madison?
Hi, can you guys hear me now?
Yes, we can hear you. Go ahead.
Perfect. Okay. The part of this was addressed a little bit earlier in terms of comparison to other states, but I know some lawmakers have been concerned with sort of Wisconsin's quote-unquote ranking among other states, and I was wondering if you had a response to kind of what those rankings really mean and if we should be concerned about Wisconsin ranking lower.
Yep. As I look at where Wisconsin is, first of all, it depends on which number you use, but generally we're in the middle of the pack. And I also, as I've looked at the numbers, they're very closely clustered together. There's a lot of people, I'd say, in the middle of the pack. There are a few states that are excelling. If you look at, for example, of doses per population, and lots of those states are very small states where healthcare workers probably represent a very high percentage of their population as well, too. So I think what is really most important for us here in Wisconsin is this is a race against the virus, not a race against other states. And we need to do everything in our power to move these vaccines as quickly as we can. We are doing that by increasing the number of vaccinators we have, by increasing the opportunities for people to get vaccine, by slowly adding additional groups into the eligible participants for vaccine as vaccine quantity grows and we complete prior groups, and continuing to make the appeal for more vaccine coming into our state. That is what we are laser focused on, is getting these vaccines to the people of Wisconsin so that we can end COVID-19 in our state.
Thank you. And that is a good place to wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dijk, Dr. Stephanie Schauer, and all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.